Now. Okay, hello everyone. Thank you all for joining. Today is the last day of the month, and as usual, we are having the second session of our group discussion. And today we'll be focusing on the future of nursing. Like when we talk about the future of nursing, it sounds really broad, and for real, it is really, really broad. Because when you look into the future of nursing, we have different areas that we can talk about, which includes technology, AI, nursing workforce, well-being, health in communities, and different things like that. But today we are not going to be focusing on specific aspects. What we'll be doing is just pick the key points that can all guide us, because this topic itself is a topic that we can cover for a long time. But since it's just a focused discussion and just a way of boosting also that we are always, always very passionate about our careers and always looking forward to ways in which we can have that boast, because sometimes we can really get discouraged or just feel like it's just too much for us to carry on. But if you're able to attend sessions like this and share ideas with fellow nurses, it helps you to also know that, okay, whatever challenge you're facing is not just you. There are other people facing that same challenge in different regions, or maybe they have also faced it before and now they have strategies that can actually help you to grow and to also overcome those challenges without necessarily losing yourself in it. Right. So when we look at the future of nursing, we'll see that the technological advancement is affecting every industry, and healthcare most especially is mostly affected. And the reason why nursing is so vital these days is because we are a people facing profession, and we constitute like more than half of the whole healthcare system. We have nurses everywhere, and again, we do a lot with the patient. We are always there with the patient. We spend more time with the patient than any other healthcare professional, be it the doctor, be it the lab technicians, be it the radiologist. So we spend a lot of time with the patient. So any advancement that is happening across the world, it is so important that we are always in the center of it, because at the end of the day, the doctor will only prescribe the medication and go. The lab technician will just conduct the lab test and go, but we are there to administer the medication, sit with the patient, discuss with them, get to understand their fears, get to understand their worries, see how they progress, sometimes, unfortunately, see how they decline. So at the end of it all, anything that has to do with healthcare, nurses have to be at the center of it. But it's unfortunate that that is not the case nearly everywhere. We are always looked at, okay, we are just options, or we are just there because we are there, but that is not our point of focus today. What I want us to really pay attention to is the what we can do as individual nurses, regardless of your region, to take advantage of the advancement that is ongoing and prepare yourself for the future. Because at the end of the day, it's not enough to know that there is a future, a different future, like more than the way it was in previously. It is all about preparing yourself and getting ready for whatever change is coming. And again, when it comes to these changes in general, we can hear of changes, but I will tell you there are regions that will experience it quicker than other regions. That's just the fact. Because there are places where they are still struggling to, provide basic care to patients, and you don't expect them to just advance to high technological levels like that. So that is to say that there are regions that will experience this change quicker than other regions. But this is not an excuse as to why you shouldn't prepare yourself as a nurse. Because, like I said previously, and I'll always say, as a nurse, don't only look at yourself based on your current location. Look at yourself like creating global impacts. Don't just say, okay, because I am here and it is not here, I am not experiencing it at the moment, that means I can just sit back there. Instead, it's the best time for you to take advantage and prepare yourself ahead of everyone else, because when there is a change, the people who adapt quickly to that change, they tend to make more out of it than those that follow later. So you that is able to take that bold step to start a process, you can never compare yourself to someone who is just coming in later on. So the goal as nurses, and especially those that are on this call today, is actually to prepare yourself, and this preparation starts in your mind. You don't only expect everything to change suddenly. You just have to keep preparing your mind. Okay, whatever I'm doing now, I know that in the next 10 years, it will not be the same. And if you want to remain relevant as a nurse that is able to grow and evolve, you must be able to embrace these changes. And if you've worked maybe in most rural areas, you'll see that there are some nurses that you come across. Maybe they've been in the profession for 30 years, and they will tell you there is a particular way they want things being done. And you that has just recently trained or just recently graduated, you know that this thing, there is a different way of doing it. Like evidence have shown that what was previously done is no longer done that way. But you're bringing in that new, that recent evidence-based practice. But because they've been in the field for a long time and they've like gained that so much experience, they still feel like that way of doing the thing, the procedure is still the way they have to continuously do it. And if you look at it in that perspective, you will see that those that are able to adapt to change quickly, you end up settling for less. And that is true, especially for nurses. We end up being so comfortable with whatever we have, and we don't want to seek any advancement. Why? Because we are so scared of new things. We are so scared of changes. We just feel like, oh, this is something I'm used to it, so I have to keep doing it. And now, if a different opportunity comes up that needs you to just shake off that old self and just embrace something new, you just feel like, okay, it's better I stay here. Although it's not the best for me, I will just stay here because I don't just want to adapt to the new changes. It's very common. It's a human tendency. But what I'm trying to say is we have to be different. We have to be those kind of nurses that wherever we find ourselves, we are able to adapt quickly to the new changes and take advantage of every opportunity that we have. Because most of the times the adaptation that we are talking about comes the opportunities comes with those adaptations, because sometimes you see like, oh, okay, let me just stay here and do what I'm able to do. But you see that when you take that bold step and start something new or something that feels challenging at the start, in the long run, you will see that, oh, wow, this is so great. At least I'm able to do something that is impactful, you know. And at the end of the day, we are not only looking at what can give us financial benefit, but I know, and for real, I can say financial benefits are very important. But if you look at the way money comes, when you give value, you can have money in return, right? When you give value, you have money in return. So just the value you're giving out, you might feel like, oh, it's not giving me, it's not yielding any income at the moment, but you're actually programming something that is going to come, that is going to be great. So one thing I want us to take home today is the fact that we have to have this adaptable mindset. Even if it feels so difficult at the start, put in your mind that if this person can do it, I too can do it. There is always a way out. Don't just look at anything and you yourself, you create a barrier for yourself without even trying. That is a dangerous route to take, which is not going to help us in any way. So, looking at the future of nursing, what I want to say is nursing, healthcare has evolved, so has nursing, but that is not enough. You need to now come into nursing and see that, okay, what are the opportunities that are hidden in here that I can actually exploit? And majority of the times, I'll tell you this for fact, nurses do invest a lot in their nursing career. And when I talk about investment, I don't only talk about financial investment, but financial investment is the top of it. Financial investment, time, energy, and all of that. So we put in so much because the 3 years training we have just to get a diploma, and sometimes 4 years to get a BSc. You know, you spend so much money in it, from one project to another, your fees, internships, you're paying for this, you're paying for that. At the end of the day, you see that you spend so much money. If like in the course of the 3 years, you spend so much money. What about your time? You spend so much time studying. Sometimes you go to school 7:30 and you're back at 4:30. So it's like you're spending, investing so much. And this investment that we keep doing, we expect that at the end of our 3 years or 4 years training, we are able to live comfortable lives. But the reality is not always true, isn't it? If you've not experienced it yet, then there are a lot of people around us that their expectations, what they expected out of their careers, is not what they're actually getting. So for you to be able to overcome some of these misexpectations, it's all about preparing yourself ahead of time. You know, because if you're only depending on your nursing career or your nursing degree and thinking that it will give you everything, it will not give you everything. And that's why you see that most times nurses will be like, okay, now I've had a diploma, going for a degree, going for a master's degree, and thinking that by increasing your years of study or going in for more certification, that will make you more employable. But that is not the reality. If you're sincere, you will tell me that there are sometimes that you will hear a nurse that has a master's degree and maybe you're asking to pay him or her 50,000 francs, the same as someone else that has just a diploma. That's very possible. So know that it doesn't matter your level of certification. What makes a difference is what you can do. Right. So don't only be say, okay, after my BSc, I will go for my master's degree. Make sure that you're going for that into that master's program because you already have a strategy. You have something you want to achieve out of that. Don't just go again and spend another, let me say, 500,000 or 1 million just to get that certificate and add it to the back of certifications that you already have. Like I will always say, the certificate you have now, if it's unable to get you a job or something that you can actually make a living out of it, I tell you, another certificate will not get you that. So you need to start with the small one you have, unless that you've seen an opportunity that requires you to upskill or to add another certification. Good and fine. But if you're just adding more and more, spending more money, going in for that without having a strategy or without asking yourself, how is this going to benefit me? What are the importance? What is the importance of what I'm doing? What are the achievements I will get ahead of at the end of this? So these are the kind of questions that you need to ask yourself because sometimes instead of going in for another professional degree or to get a master's degree after you've had a BSc, it is better to spend that money and learn other skills because we live in a world where it is what you can do that matters. It's not what certificate you have. Sometimes people just want you to speak about yourself. Sometimes they don't even care about your certificate. It's only at the end of it that will be like, okay, what do you have? Majority of the time, it's not only what you've got like in like your certificate, but what you can do. So if you have that doing mindset, it will help you to prepare yourself for the future. So that is to say, if you have your certificate, your BSc in nursing, or you've just completed a diploma, what else can you do? Master's degree is good. Yes, it's very important. I love going to school, kind of, but you need to be strategic. It's not all about having another degree. So ask yourself, what other skills can I learn outside of my nursing degree that can help me to become skillful so that I can actually provide for myself? That is the future of nursing. The future of nursing requires nurses that are able to, upskill and use those skills across different industries to make a living out of it. Because if you're only depending on what maybe your employer will give to you at the end of the day, you will struggle because it will never be sufficient. Again, the employer is out there to make money, and if they don't have enough to give to you, you can't force them to give more than what they are able to give. And again, there are some regions that they just have the ability to pay very low, and there is no way you can just change that thing in a day or in a year. It takes time for change to be instituted. So you just need to know that, okay, at this point, what are the skills I need to learn? Do I need to learn video editing? Do I need to learn content writing or something? Or do I need to start something at the level of my community? Because majority of the times, the kind of impact we are looking for is a kind of impact that people would celebrate us on social media, tell us, oh, we are doing beautiful things. Whereas in our communities, we do attend churches and nobody even knows that you are a nurse. There is no day that you've actually picked up yourself and said, okay, this month I'm going to have this initiative of just sensitizing the public. And I tell you for a fact, you see the impact that starts with your community, it is long lasting than the one that starts with social media. I tell you that for a fact because the people on social media, they only know you there, but the people in the community, they know you in the community for who you are, and they know you again out of media. So that means that whatever happens out there, you can still fall back, right? So your impact should not only be trying to do big things, or the value you want to provide should not only be trying to do big things in one goal. What you should do is, okay, this is what I'm really passionate about. Okay, like Tabitha, I know you're really passionate about elderly care, right? So how many times have you taken it like as an initiative? I don't know if you're a Christian or not. To take it as an initiative to say, okay, I'm gonna speak to my pastor and I will talk this day on maybe I will do a health talk on elderly care because in every community we have the elderly there. And the thing, especially in the African context, is that we don't really understand the care of the elderly. And at the end of the day, when somebody starts presenting with symptoms that we should have managed them and just show them that love, we don't even know what to do. And at the end of the day, you see that people they age in pain, they age in regret, and they don't really enjoy their old age. So you have that knowledge and it's something that you're passionate about, and it's something that is very, very needed, much more needed in our world today. And in the next 10 years, that is something that will still be needed. Why? Because the world is aging, the population is aging. There is at every point of time we always have an elderly person. So it needs that person that is able to step up and maybe design strategies that to say, okay, for this family, you're a family of five, you have this elderly mom or elderly dad. So I'm going to design this particular strategy for you. This is how you're going to look after this elderly person. But how will people know that you're that strategist for the elderly if you're unable to like present yourself and make them know that that is what you can offer? right? It looks very small, but I will tell you for a fact that a lot of people that are just looking for you to show something different, and before you know it, you say, okay, maybe in your church, before you know it, there's somebody that works in another NGO and say, okay, can you come and do that same presentation? Before you know it, it keeps going there, and by the time you go to the third, you can say, okay, you know what? I charge this for an hour. That is how it starts. Don't just expect people to just start paying you for a service that you've not actually shown them that you are good at it. So those are the kind of ways that we can prepare ourselves for the future. So take for example, if you are doing that as a side thing and now you're still doing your normal job in a hospital, tell me how you will struggle. There's no way you will struggle. And again, you don't need to look at the start of it. The start of everything always requires, a bit of patience, a bit of consistency, a bit of commitment, and a bit of believing in yourself. But that doesn't stop the process from going on. I'm telling you for a fact, if there is one thing that you should take home today, it should be the fact that you need to choose something that if they say, okay, bedside nursing is out of it, you can still use your nursing degree to do it. So whatever you're passionate about, find a way to monetize that passion, because passion alone is not enough. If you're just there, for example, I do write for fun, I do write like it's passion for me. But the only reason why I'm not saying, oh, I want to monetize my writing skills is just for personal reasons. But if I want to do it, I will do it. And if I want to do it, I will get companies that will pay me for that. So it's not all about passion. If you are only passionate about something and you're doing it only for passion, at the end of the day, you will burn out. That is just a fact. Because there is something that reward does to yourself. If you have only applause, you say, okay, well done, you're doing great. There is this part of the equation when it comes to reward. If it's able to take care of your basic needs, it will keep you boosted. You'll be like, oh wow, this can really work. So this is something that is nice. And then you keep on putting more effort, re-strategizing and making sure that you're up to date with whatever strategies that you are bringing to the table, right? So it is important that we know all of this. And when it comes to technology, a lot of people they shy away from this topic, technology. But the truth is, technology is not as complex as what we think. We all have Android phones, don't we? We actually logged into this Zoom meeting, didn't we? So it is not as complex as we think. It's just because we've just had it in our minds that, oh, this thing is so difficult, and even the basic things we just feel like it's too much. Sometimes it's too much, especially if you're learning a new system. But that shouldn't stop you. Whatever you can do, anything technology or AI is here to enhance your job, to make it more, easier for you to do more with less time. That is the importance of it. It's not here to teach you or take over you or replace you. It's here to help you so that you can do more within the shortest period of time. All right, so I will be rounding up. Like I said, I wanted to just speak for 20 minutes and we use the rest of our time to just answer questions. So just let me know if you have any questions. Just drop it in the comment section. Like I always say, there is no stupid question. Whatever your doubts are, drop it in there. There is somebody that can help or even learn from your question. So what I'm trying to say is the future of nursing is bright for nurses that are able to take initiative, for nurses that are able to upskill, and for nurses that are able to adapt to change. So for real, change is never easy. It is not something that is very easy. I remember the other time we were talking to some people about the changes that are coming in different countries. And in our own place, they were trying to introduce a new change, but everybody was so reluctant to it. I tell you, so don't think that is because it's not about you as an individual. Majority of the times, we as human beings, we don't like to change what we've already known or what we are used to it, right? So don't take it too personal. Don't feel like, oh, because it's just me, I'm just this or that. No, don't take it too personal. Just know that whatever is coming, put in your possible best. We are all brilliant, as nurses, we are all brilliant. Think about the number of courses that we learn per semester, and the number of times we need to do this assignment. We are done with CA, we are doing exams, we are doing presentations, we are doing all of that. That is to show you how brilliant we are. So that is something that is already inborn. Once we are through our training program, we learn those ways and we adapt, we become resilient. So let's not only live that resilience when we complete our studies, let's carry it into the field and make sure that at every point in time we are prioritizing ourselves, most especially because the future of nursing also includes well-being. Because well-being is very important. There are a lot of people that burn out even within. Research has shown that a lot of new nurses burn out even within the first year of practicing in nursing, so they intend to leave the profession. So that's something that you need to prepare yourself ahead of time so that you know what to expect. And if anything is coming, it will not come as a shock. You'll say, okay, at least I knew that this was what I was expecting, and I knew that this is what was going to come. So I am actually prepared for it. So I hope that we all can, learn something, a skill, whatever skill. It could just be a passion, really, that you can actually monetize in the long run and you use it to help your career so that you'll not only be depending or getting frustrated because of what you're being paid or what your employer wants to pay you, or you just feel like, oh, I've just spent, like, let me say, maybe 2 million francs to study for 4 years, and now I'm unable to even return the money, or I am unable to make a living out of it, right? So please do let me know if you have any questions. If you can speak, good and fine, but if not, you can drop it in the chat. I don't know if you are still there.